Welcome, Health Impact audience. We're in for a jam-packed session about some of the realities about how businesses, and especially healthcare businesses, should safely reopen, and what that actually means to safely reopen, and especially when a resurgence is possible. Something can happen literally, almost at any time as far as the pandemic spiking in almost any area. So we've got a great discussion with Amy Perry, who's the Senior Vice President of Integrated Care Delivery and CEO at Atlantic Health. That's in the New Jersey area, of course. And you may recall a few months ago, New Jersey and New York did have their own epidemic within an epidemic, right? Because that area felt all of this. They had to go through all of that pain. And one reason we've asked Amy to jump in and talk to us about this is they successfully handled the pandemic at that time, prepared to reopen, actually reopened, and now they've handled thousands of COVID cases, plus have safely reopened. So we'd just like to explore where you are, Amy, with that. But before we jump into the specifics, just tell us a little bit about yourself and Atlantic Health, and then we'll talk about the preparation side.
Thanks, Shahid, and thank you, Health Impact, for taking the time to share this experience. I think it always helps when we start a conversation. So hopefully that's what we're doing today. Atlantic Health System is about a $3 billion health system that has lots of different facets, 7 hospitals, 1,000 employed physicians, about 5,000 person medical staff, home health, ambulance, home hospice, everything you can imagine a health system would have in order to provide real continuity of care. So very large health system serving about 5 million people in northern New Jersey, children's hospital, rehab hospital. It's an exciting place to work, and providing a lot of care for about a million people every year.
No, that sounds terrific. And, so you guys went through quite a bit. You made your way out of that, but you're also hearing about all the other resurgence in other parts of the country. Tell us just a little bit about your area, about what you guys went through. What were some of the numbers that you saw, and how are you feeling these days about your preparation for what could be more to come?
Great. Yeah. So I think it was interesting to be first in the United States to be hit with the pandemic. We are only one train stop away from New York City, so there's really no wall between New York City's experience and our experience. So we felt very quickly this enormous surge. And with a density of about 5 million people, there is very little that we could do initially to curb the growth of this. And so when we started seeing COVID patients around the beginning of March, we just really didn't know what to expect. And I think that the most difficult part of this was the exponential growth that you get when you start to care for a COVID population. I think that it's one thing to say surge. It's another thing to feel surge. I mean, it is a tremendous challenge to literally have to use 15 times your normal PPE, your protective supplies, to need 4 times your intensive care beds, to need 10 times your negative pressure rooms. So, and also while you're doing that, while you're doubling your care. So the amount of resources that are necessary to create negative pressure rooms, to put in air scrubbers, to add ICU teams, to have to develop pod care, the speed at which our team had to engage, I think was the scariest part of this. And I think that being first, there was a tremendous fear of the unknown. We really didn't know if we could slow it or stop it. And so we were all going up together on this very scary curve. We saw at Atlantic Health more than 10,000 patients. We peaked at about more than 900 census. So we had this tremendous number of intensive care patients and patients requiring critical care I think that is, the experience that everyone will take away. I think that the interesting part, and sort of one of the lessons learned, is why we did so well, I believe, is because of our teamwork and because of our culture of innovation that we didn't invent last month. This is something, I think whatever you put into your initial, your employees, your team, what you value as a health system, that's going to come back at you in either a really good way or probably not such a good way. But our team felt very empowered to create new solutions. So we actually have a program called Atlantic Healthcare Advancements. It's AHA. So we appreciate ideas, and people felt very free to implement ideas. We actually had 70 awards for the most amazing on-the-fly employee created inventions to figure out ways to keep our patient and employees safe. So it was that kind of just free form learning together, sharing those best practices across the system that I think got us through in the way it did. So, when I look at lessons learned, I say empower your frontline team members, share those best practices, don't do anything in isolation. Especially when you're learning, everything is new. I mean, we had no guidebook. We were really trying to learn from what happened in China, what happened in Italy, learning from our colleagues in New York City that were maybe only 1 week ahead of us. And so again, that just rapid fly innovation, and also having to take care of our patients. So I love this expression of how did you reopen? I always say, I wish we could have closed, because I think this would have been a little bit easier. We had to stay open the whole time, and it was really our privilege to serve our community. But during this time, we did a lot of surgeries, life-saving surgeries. We have a trauma center. We delivered over 1,000 healthy babies. I mean, this was we had to coexist with COVID. We had patients that needed our services that didn't have COVID. So I think it was a dramatic sort of discovery to learn how we could live in both worlds at the same time. And I think
one quick question about that might be that, so you mentioned something which is very important, and we've always tried to live by this idea to empower the frontline workers, but we don't always, we aspire to it, but we don't always achieve it. But you're saying that something happened during the last 4 or 5 months where did you empower them differently than you did before? What does that mean to empower them to make the decisions and not do it in isolation? Any specific examples you could give about that?
Well, I do think that you have to have that built into your culture, that people do feel like their voices are heard. And so I can't give COVID credit for all of that. And we are fortunately a 12-year winner of Best Place to Work. And the way you get to be a best place to work is your employees feel like their voices mean something. And it's true here. But I think to your point, and how COVID changed that, and how COVID it actually accelerated our ability to do that. And I've asked people, how were we able to go from 50 televisits a day to 3,500 televisits a day in essentially 2 weeks? Mm. And the reason we did that, and I think when I talk to people, the response is really this shared problem, this singular focus that we had to get this done. There was not a lot of confusion about which way could be better. It was one place where perfection didn't get in the way of progress. Mm-hmm. We had to solve these problems in front of us, and our team was completely focused on the end game. So ideas were welcomed, quickly implemented, and that kind of speed of execution, I think, is what then got people more engaged. Well, wow, we just did this with telehealth. Let's do this with, other things. Let's invent this. We actually got some respirators without valves, ventilators, but we were desperate for ventilators. So our facilities team took a 3D printer and printed the parts.
Hmm.
You know, because we had to use what we had to ensure that our patients got care. So I think every one of those innovations just built on each other and kept us moving.
And that's what gave you a little bit more faith that you could take on more work because you've obviously had the folks that could adapt to that. So one of the challenges of what's going on from a few months back versus a few months forward is anything lightening up? Or is this pretty much all the same? Like it's been like this since March, and you see it really accelerating because we're not going to see a dip in the pandemic anytime soon.
Oh, great question. So our curve is down. It took an excruciatingly long time, it felt like, to go from 900 to what we are now, which is 30, a census of 30. So huge reduction. But it went up in a matter of weeks. It took months to get to 30. So it's a very slow ramp down once you start that exponential growth. And so that's, you know, it does go down. So for those of you watching that are on your downslope, it does go down, but it goes down very, very slowly because these are very long length of stay patients, very complicated patients, sometimes very hard to place patients post-COVID because of the challenges with mixing populations. So patients, but then when you get to this point where we have a very controlled now number of patients, we're just so grateful to the community because the community is what is protecting us now from our next surge. Masking, social distancing, taking this very seriously. And the second that we lose sight of how contagious and how fast this grows, we're going to be back on this ride again, and nobody wants to get back on. Mm-hmm. So we are completely dependent on our community and our government and leadership to make sure that we can keep this at bay for as long as possible.
Yeah, that makes a lot of sense. And when you think about what you instituted over the last few months, we're saying prepare to reopen, but you were open the entire time. But there are others on the ambulatory side and smaller health systems, which did literally shut down and have been reopening. What were the barriers to the adoption of some of the new rules, the new techniques, and things like that you maybe saw? And if you didn't see that many barriers at Atlantic, are there barriers you think that others will have, and do you have some advice on how to get this staff? Like the workforce is the most important part of this entire discussion.
Yeah,
and you were saying you were already prepared with that for 12 years running, so that made it easier on you guys. But tell us about the workforce barriers to adoption for some of the new things that you're working on.
Well, I think education and communication is key. One of the things that I think, and I was on a medical executive committee call this morning, and what I heard over and over again was the appreciation for communication. So I think frequency, transparency can help organizations navigate this. Mm-hmm. In one of our regions, we had medical executive committee conference calls 3 times a week. At other hospitals, they had calls with their medical staff every day. So I think that having this communication and education around here's how we're going to reopen. And the way we did it was very patient-centric. So time to impact. Who is going to be negatively impacted like a clock if we don't take care of them today? And the way we rolled back into this was through a very precise prioritization project where we ended up making sure that our most at-risk patients got served first. I mean, we're now to the point in our situation where, we're back to doing plastic surgery and things that we would consider selective and optional. But at one time during this journey, that was not happening. We were very selective. This was trauma cases, this were cancer, malignant tumors. There were things that had to be taken care of at that moment. But now we are back to, really having a fairly normal surgery and procedure schedule, because I think we were able to let the community know and give confidence. Again, a lot of this is about confidence in our physician and team community that we're safe. that we know what we're doing, that we put in place the things that we need to do to keep our patients and employees safe. And it really comes down to that confidence and trust.
And so talk a little bit more about that confidence and trust. You guys have a fairly regimented approach. You had it during the outbreak in your area. And now, of course, you guys have policies, procedures. Highlight some of those and at what level. I mean, we hear things like, well, unless you have a lot of testing, you can't reopen. Unless you have a lot of tracking, for example, contact tracing, you can't reopen. But neither of those things are true for you guys, right? Because there's a lot of non-testing going on in your area. Not a whole lot of contact tracing necessarily is going on in your area, but you've been able to successfully reopen. So what's been the successful part of you getting that credibility and that confidence back in the patients?
Well, we do very carefully monitor the rate of transmission in our community. So we do contact tracing. We are looking for pockets of problem areas. We've just been very fortunate that that's been very low, so we've been able to manage it. We do test every patient who's going to undergo a surgery that's not happening in a life-saving kind of way. But for everyone else, just to make 100% sure that we're providing the safest care, we do make sure no one has an active COVID test. So we are going through that process. That whole testing process is a very big deal. We at Atlantic Health, as others across the country, are stressed by the reduction in the reagents and accessibility to reagents of all different testing types. There is only a certain amount, and I think that the manufacturers are trying to allocate them in the ways that they feel are that make the most sense given the hotspots. But I think that pretty much means that no one has what they need. So the testing shortage continues to be probably our biggest challenge moving forward. We've really struggled with it.
Yeah, but it sounds like, and I think everybody's struggling with it, but it sounds like you guys have been able to put that there is a way, even if the testing isn't up to par as what we would like, that there are policies and procedures that can be put into place to not remove that risk, but to help mitigate it, prioritize it, focus it on those that need it the most. So it sounds like you're been able to at least do that. And so when you think about, you mentioned the community like many times, which is great because it is they who are going to drive the numbers up or down.
Right.
But when you think about the community, how did they react when you went from your 30 telemedicine visits to your 3,500? What did that happen as fast for the community members as it did for the clinicians to make that happen? Or were the patients saying, hey, move faster, and it took you guys longer on the health system side?
That's a great question. I think it kind of happened in parallel because our patients weren't used to using telemedicine. So this was a learning experience for all of us together. So we really learned together. I think our patients wanted advice. They wanted to know. We set up a call center almost immediately on day one. Just call this number. We'll help you navigate. So do you need to see a video visit? Can we just talk to you on the phone? Can our nurses help you? Again, trying to help people navigate this new world. We were sort of doing it all together, and we weren't doing it perfectly. I mean, at first we tried FaceTime. We tried every kind of video product you could think of, and Zoom this and every kind of way you could possibly, manage it to make sure our patients had the care they needed. And they couldn't have been more flexible. They just appreciated, again, having this contact with their physician offices. Most of our physicians stayed available. If not an office experience, our physicians stayed available to their patients. And I think that was helpful. But really more so, and I think you saw it a little bit in the news, how this outreach from our community actually gives me goosebumps. I mean, they sent food to our employees almost on a daily basis. We're talking 18,000 people who are getting food from our community because of absolute love, like just no financial reason, there was no repayment. It was just this outpouring of, mutual respect. And I just don't want to lose that tremendous learning experience that we're all seeing when our communities come together for the most important piece, which is keeping each other healthy. It's moving to me.
Yeah, that seems like it. And so when we look at innovation in general, there's the institution's readiness for the innovation. There is the workforce's readiness because the institution is ready. And then there is the patient's readiness. And not all happen at the same time. But what we've seen in the past is that patients have actually been readier than the clinicians have been, which may have been readier than the institution has been. Now that things have been accelerated quite a bit, and you can learn literally in a week what would have taken you 2 years to learn before, what do you think stays from this learning set, and what is going to kind of like rubber band back to where it was before? Is anything going to stay at this level of like the telemedicine, remote patient monitoring, and those areas, or are we kind of like going back?
That's a fantastic question, a very important question. And I think that a lot will depend on reimbursement. Honestly, that's really what is going to drive behavior in a lot of ways. If the government or the commercial health insurers all of a sudden say, we're not going to reimburse telehealth, it's going to make it really complicated for us to continue to provide that kind of service. And that's part of the reason that where I think we've been successful is by having value-based payment structures. And, Atlantic Health, we have some 100% risk-based arrangements. And under those arrangements, we can provide as much telehealth as we want, and we don't have to worry about the, per click kind of reimbursement that most of us, have to struggle with. So I think it's going to have all of us looking at our reimbursement systems more carefully and figuring out, do they support innovation? Do they support what the consumer is asking for? How do we make those shifts into different kind of value-based structures so that we can just do what's right for the patient, regardless of whether or not we're going to get paid per click or per call or per whatever? That's really going to be, I think, the way that the positive changes become sustainable.
Mm-hmm. Yeah, that's terrific advice. So as we close up here, and then we're going to open it up for our live Q&A, tell us, for those in states like Florida, Texas, and others that are now going through what you were going through a couple of months ago, how would you suggest that they act maybe differently than what you're seeing in the news? Obviously, you're not flying down there and you don't know what they're doing on a regular basis, but you can probably figure out remotely what some of the mistakes that they might be making. So without holding judgment on any fellow colleagues down in any other states, tell us what you learned and you wish that you knew before having to go through this, which now you can teach your colleagues.
Well, what I sort of see happening, which I think is interesting, is I feel like we're almost seeing this thing where people have to touch the stove themselves. Like, we touched the stove here in the greater New York area. We touched it. It is not pleasant. We don't want to go back. Right. And so I feel like it's a little surreal if you haven't experienced it directly. And so it's harder to make this real to people. Mm-hmm. It's like when a hurricane hits Florida. It's a bummer for them. But other places in the country don't really feel it. So you have to have that leap of faith that when I tell you, you don't want to have this in your community, it's for real. It's awful. It's very difficult to get your arms around. And so I think that, you're seeing this in Miami, you're seeing this, in other places where the community is going to have to decide that they've had enough. They're going to have to work together to socially distance, to wear masks, to listen to the science, because the science works. We are a perfect example of how you stop COVID from exponentially growing. And so I'm hoping that the states that haven't experienced, first of all, that are in the middle of it, do everything they can to pull it back. And the states that haven't experienced it continue to follow the suggestions of our medical experts, because they work and they're important. And we could save a lot of people who have chronic conditions, our older population that's at significant risk for this. And this is a team sport. We got to work together to get this to get this under control until we have a reliable vaccine. So that's my advice. Let's all trust, don't touch the stove.
That is so perfect. I love that analogy. And of course, we've heard that the science that works in New Jersey, New York area may also apply down in Texas and in
Yeah,
Florida and other places. So
exactly.
let's give it a shot. You
Yeah,
never know.
exactly. This is, let's all try it. It worked here. We're praying that it can remain in this way. But every day that we have less than 30 COVID patients, we all are just relieved, that we're saving more lives. People die. This is a very, very serious illness.
No,
And,
that's exactly right. And well, that's
yeah.
no. So just in closing remarks, just tell us personally what is the biggest fear that you have as a leader at Atlantic Health, which is also means you're a leader in the community. What do you fear people might relax in order to bring this back? Is it something as simple as not wearing masks and social distancing, or is it something more sinister in the way that somehow they're feeling, well, we beat it once, we can beat it again? So would that happen in your community?
I hope not, but time will tell. And, I hope that there will continue to be this dedication to mask wearing and social distancing, because I really think some of the ingredients of keeping this at bay are fairly simple. But people have shorter memories than we wish. And so, yes, I'm afraid that time might impact our next surge. I'm hoping that if we start to spike, people will react quickly. I think it's actually a plus, I must say as well, that we don't have a lot of legislative infighting here. There's kind of we're speaking with one voice. I think that makes the directions a little bit clearer for people to follow. I think this is a terrible burden on small businesses, and for that, in that way, I'm sick about the restrictions. But on the other side, it's a very difficult thing to walk through an economic reopening and not start a second surge. So these are very difficult balances, and I understand how all of these decisions, are life-changing for people. But I also know that working together, we hopefully will all focus on the most important thing, which is preserving human life.
No, that's a perfect way to end this. And so Amy Perry, thank you so much for spending some time with us, teaching us a little bit about how you got through this and how there is a light at the end of the tunnel.
There is a light.
That is terrific. So with that, we're going to close up here. And